Hello, I'm Julie Calnan and I'm hoping that I will be re-elected again for the Lakes District Health Board. So for me the last 3 years has been a huge learning curve. Health is not simple, it's an extremely complicated area to work in. It takes a lot of time to get your head around exactly what's going on, especially with the financing side of things. So I really believe that a second term for someone is imperative. We've got our handle on things now and we're ready to go. Fired up, knowing what our priorities are and actually able to give it our best. Rotorua has a unique demography. Our demographics are that we have a lot of people in poor housing, poor education. We have huge diabetes problem in our community. We have massive smoking problem in our community. Nutrition is poor in many of our homes. And this is causing a huge strain on our health dollar. So to put it in a word, it's Maori health in this community, which is the biggest issue for me. We have to stop Maori dying young. The main people in our community who can tackle this are our primary health organisations. So from our general practices to many other organisations in our community that exist, we're working really hard on the cliff edge, basically. I think more money needs to be put into that area, and we need to be more aware of what we're achieving, because at the moment our goals really aren't telling us. We have goals, but we don't seem to be given information, feedback as to how we're achieving, how well we're doing, and I think we actually need more information. We can't sit as a board and say we want X million dollars there or want X million dollars there, but what we can say is we know we have a problem with diabetes in our community. We need to know how big is that problem so that we know and how well we've done at reducing that over the last 12 months. That will tell us, are we throwing enough money at that issue? If we don't have that information, we don't know if the spread is right. When we get that information back, then we can talk with our management, with our planning and funding department and say, look, that isn't achieving the goal we want. Either it's being spent incorrectly or not enough is being spent. For me, being on this board is to look globally. I don't think it's correct for me to just look at one issue. I can't target elderly over mental health, over Maori health, over our youth. It's my job to look globally, to make sure that our hospital is providing top quality care, that our staff are compassionate and professional, that complaints and issues that happen in the hospital are being dealt with correctly. It's my job to be on top of that.